The study I did for City Council of Albuquerque was called the Four Hills Speed Hump Analysis Study. And I hope it's going to be a landmark study because I did several things that I don't think had been previously done. The first thing was I was trying to get an accurate assessment of how effective the speed humps are in actually reducing accidents. I went through all the data I could find, 93 street sections of the city where we had data on volume before and after the speed humps, accident data before and after, 2 years before, 2 years after. It is probably the biggest, in terms of sample size, the biggest database I've seen in terms of assessing what is the accident effect that speed humps have before and after. And what it came down to was that we found that 2 years before versus 2 years after, we were seeing a reduction in accidents of about 6 to 7%. Have to qualify that by pointing out that there is a general tendency for the accident rate to decline over time. It's declining about 1% a year in New Mexico, for instance. So it's a single-digit decline. It's a very modest decline. It has some effect. Based on that, I was, to make an assessment of the total public health effect of speed humps, I was comparing the number of lives that might be saved by speed humps, and I assumed that it would save 10%. We reduce accidents by 10%. We were comparing the number of lives that could be saved in one particular neighborhood to the lives that might be lost due to delay to emergency vehicles, their inability to get to cardiac arrest patients as soon as possible. And it was a very intricate process. I don't think it's been done in any report before. The bottom line it came down to is that the net effect, at least in this neighborhood, was that the lives lost to speed humps would be several hundred times higher than the lives saved. In fact, the lives saved would be more or less zero. Now, the accident side of that was that we got very precise data as to all the accidents in the neighborhood going back for 15 years. I took a 10-year average, derived the percent of accidents that would be typically fatal, which is usually less than 1%. So we could quantify exactly how many lives you might reasonably expect to save by having the speed humps in, and it came to about I think it came to like 0.03 lives. In other words, about zero. Then we did a very elaborate analysis where we took the American Heart Association survivability curve of how many minutes it takes for the emergency team to reach you if you have a cardiac arrest versus your chances of survival. And like so many curves, it goes like this, so that if they don't reach you within a few minutes, your chances get very bad indeed. And after about 8 minutes or so, your chances are quite minimal. On the other hand, if they can reach you within, say, 3 or 5 minutes, your chances will get a lot better. A lot of the pertinence of this was they were going to put in a new fire station near the neighborhood so that the emergency vehicles from the fire station could, in fact, get to people pretty quickly if they were not unduly delayed. So what I did was I created a very elaborate mathematical model, and it showed you what would happen if there were no speed humps. Then it showed you what happened with the delay imposed by the speed humps. And by the way, those delay figures were entirely based on the Portland, Oregon Fire Department's own survey of how much different types of speed humps delay vehicles. Well, putting all that in, and it's all in the report, we came to the conclusion that with a new fire station and everything else in place, you'd have several hundred times more people die as a result of the speed humps than would be saved by them. They also asked me to look at what would happen if we had a fire station further away, so it wouldn't make as much difference and so forth. In that case, it also came down to you had several hundred times more likelihood that you would be killing more people and saving more people. So I recommended getting rid of most of the speed humps. The other thing I did in this study was I gave them some information about alternative devices that do not impede cars. One of the biggest points here is that the head of the New Mexico Medical Association himself said, we don't want anything that's a traffic impediment. That is, anything that's actually going to block or delay an emergency vehicle is a negative in terms of public health. So I said, okay, there are other devices, other things you can do that are not going to impede emergency vehicles. For instance, striping the road, having a little bit of narrowing on the road by bulb outs or curb extenders, having little islands, pedestrian raised islands in the middle of the road. All these things, there's pretty good factual data that they do tend to reduce speed somewhat, do reduce accidents. Even local communities here like Palo Alto has it in their rules and regulations that in fact the little raised island is used to slow traffic and make the streets safer. So I recommended doing some of these alternative things, replacing the speed humps. What happened was a big political controversy over the study I did. The councilman who'd sponsored the study was in fact challenged they got petitions to have him recalled a few months ago. And there was a big to-do and debate in the community. The ultimate result was that in the recall vote, the councilman won 2-1. So there was tremendous public endorsement of the policy and of the recommendations I made. The City Council of Albuquerque, in a tremendous session, great testimony on behalf of many people, voted 9-0 to adopt the plan I recommended. So you have a very interesting situation where there's a study that is now out there by a big American city telling you that speed humps are in fact a public health menace, and a decision by a major city to begin to remove them and do other things. The other topic I want to talk about is the business of one-way streets and converting one-way streets to two-way. It's something else I've done a lot of research in. And in fact, I now have the data for Albuquerque, New Mexico, downtown area where they did this. I haven't tabulated it all yet, but I've looked into this for several years because I was amazed to hear all over the country cities taking one-way streets, making them two-way, and claiming that there was no safety problem or that it would actually make them more safe. There's no data whatsoever supporting that view. Quite the contrary, all the data I found from Denver, Colorado, from Lubbock, Texas, and now from Albuquerque show that every time you take a one-way street and make it two-way, quite predictably, you raise the accident rate. And you not only raise the accident rate for motor vehicles, but you vastly increase the accident rate for pedestrians. And that's not a surprise because I've got studies going back to the 1940s from about 20 different cities, including those in US, Canada, and Britain, that shows that when they first created one-way streets, typically the biggest beneficiary was pedestrians. That is, typically they cut the pedestrian accident rate in half. Just one move immediately did this. And that data is replicated all over the place. Studies in, from Portland, Oregon to New York City to London that show that in every single case it vastly improved pedestrian safety. It in fact was the most effective measure to improve pedestrian safety other than the traffic signal that's been devised in the past century. So I'm astounded to hear planners claiming that if we go from one-way to two-way, it's pedestrian friendly. But that is exactly the term that's being used. They're out of touch with reality. In every single case that I've examined, it is in fact increased accidents, increased the accident rate. It is a public health menace. And really that's all I need to say. That's a pretty good summary of that. So I can take any questions. Yeah.
Does any of your work have anything to do with traffic bumps on private property like malls and things? Do they actually serve a useful purpose there, or is that kind of outside the scope of what it is? To me, they're the most irritating, but...
You're talking about speed humps and bumps on shopping centers and hotels and places like that. I haven't touched upon that because, I only really have information. It was only commissioned to look at public streets. You're right that in many cases they do tend to overdo it. They make things a lot bumpier than they should be, and they do cause problems. I think the problem with a lot of the shopping centers is that they haven't caught up with the idea that the bumps and humps don't need to be so abrupt, and that there are other ways they could achieve it. But it is a problem because the more that there's a tendency to do that, that in fact can exacerbate it. It certainly creates problems for the motor vehicle in terms of the damage to the vehicle. When we talked to auto body shops in Portland, for instance, they said speed humps are the greatest thing for our business. Ever since they put in the speed humps, we've had everybody coming, it's just been a terrific business because of the damage it does to vehicles. But sometimes you do have emergency vehicles that have to go through shopping centers and places like that, and it is a problem for them. Yeah?
I think people would be interested in knowing the actual risk that you calculated over 50 years, the increased number of deaths with them as opposed to without them.
Well, yeah, it came to, as I say, you had several hundred times more people that could be estimated to die because of delay from the humps than would be saved by the humps. And over 50 years, I think it was the number of people that you could reasonably expect whose lives would be saved by the speed humps is 0.03. In other words, basically 0 people. In fact, that neighborhood, typical of a lot of residential neighborhoods, there were no traffic fatalities. There were, in fact, even very few traffic injuries. The accidents tended to be a low-level nature. The speed was not. Speed is typically exaggerated as a problem. First of all, anybody who studies any degree of traffic safety data realizes that there is a very poor correlation between speed and safety. In fact, by far the safest roads are the freeways, which are the fastest. The roads that in fact have the highest accident rate typically are these little local roads where people are going 20 miles an hour. And yet it's amazing how many accidents occur on them. And even in terms of fatalities, freeways are the safest, local roads are the most dangerous. You're more likely to get killed there than driving on 101 or I-5. I mean, those are the facts. There also are tremendous divergences on roads depending on how they're designed. And there is a wealth of traffic studies going back a lifetime that shows you how to design roads properly and how not to, which is now being ignored. Yeah.
50 years ago, I was in police work, and I remember so clearly that the way you determined the speed limit was to do a survey, an extensive survey, and then take 80% of what the people were driving, the speed they were driving, and that's your speed limit, because that people are reasonably careful.
Yeah.
People. And so it was the 80% rule. I don't know where that was abandoned.
Well, I'll tell you about that. That's still the rule in California. In fact, it's 85% percentile. That is you're basically, in effect, letting the motorists determine the speed limit. You assume that 85% are driving reasonably, and it's only that top 15% that are going too fast. So you take the speed that corresponds to the 85th percentile. In California, that's the law. In fact, if you get a speeding ticket in California, you can challenge you. You can say, have you done a speed survey on this road in the past 5 years? And if they haven't, the ticket is thrown out. But in a lot of other states, including New Mexico, that isn't the law, and the speed limit is essentially determined arbitrarily. This was a road where they claimed the average speed was 32 miles an hour. They set a speed limit at 25. Now, in California, the speed limit would have been raised on the road to 30, and it would have been essentially a non-issue. The other thing about the speed business is, you know how speed is measured these days? Very interesting. We have a tube here, and we got a tube 12 feet away or 16 feet away, and that's one spot on the road, and then maybe a mile away we got another tube and another tube next to it. Now, what I found very perplexing about this neighborhood was that you have a north road and a south road. The south road was a non-issue. Nobody was doing speed humps. There was no interest in anything. The north road was all the controversy where they put in the speed humps. Now, the south road had less traffic, it was straighter, it was broader, it had nothing on the right side of it because it's just open fields. It was a road that was much better suited to moving faster. And yet, if you believe the city's tubes, the speed on that south road was only 26 miles an hour, about the speed limit. The speed on the north road, which was a politically controversial road, was 32 miles an hour before the speed humps. And then, of course, after the speed humps, it goes down to about 25 miles an hour. And the south road also stays, after the speed humps, there's no change there. It just stays at about 25, 26 miles an hour. Now, I was kind of puzzled by this because it didn't make any sense. And then it occurred to me, if your way of measuring speed is simply by having a handful of tubes out on the road, and you have a lot of neighborhood zealots who want to put in speed humps, what do? As soon as they see a speed hump, they drive as fast as they can, and they get out and they drive many more times. So basically, they have the ability to influence the numbers and exaggerate the speeds. And I suspect that was happening there. When we did it, the firm I worked for in Portland, for instance, we had a different method where we would actually clock exactly to the second each vehicle when it began this point and when it passed that point, so that it was a secret survey. Nobody knew about it. Nobody could influence the results. Nobody would change their behavior. We got very different kinds of results with that. So I think that what you have in Albuquerque and a lot of other places is a sort of self-perpetuating process, because the people pushing the humps can, in fact, by speeding over these tubes and doing things like this, they can make the effectiveness of the hump seem greater. They can make the speeding problem seem greater. My question was, if it's so dangerous, if it's such a dangerous road because you feel people going so fast, why are there no accidents on it? Why do we have 2 years before the humps there were 0 accidents? You know, you're sort of solving a problem that doesn't exist. Yeah.
Slightly off, but are you aware of any research into school zones?
Not much. Well, I'll tell you about the school zone is that in some of the smarter places, even in the city I live in, which is not that smart, they realize that the best thing for the kids to cross the street is to have a very broad median strip, a raised median, because they know the kids cross the street anywhere they want to. They don't necessarily cross at the right place. They also realize that if all you have to do is look one way at a time and walk over one lane at a time, that's a lot safer for the kids to handle. That's a lot less likelihood for them to get into trouble. So I think that's a very good measure that's worked out rather well. Yeah.
Last year at the American Dream Conference in Atlanta, there was an assistant police chief from Austin, Texas, that made a very similar presentation.
Yeah.
I didn't know if was he using your data, or is that a whole separate study?
No, I was using his data and everybody else's data, and then I've created a whole lot of new data that nobody else had. For instance, I had not found any study done that really had done a proper professional job like we're supposed to in traffic engineering of what was the accident reduction before and after with speed humps. There was a Portland study, which was the best thing I had to go on. I think they made some math errors. They had about 1/3 the sample size that I did, but they found only a 5% reduction in accident rate. I found about a 6% reduction. But other than that, it's amazing how there's a lack of any real information. I mean, there's a claim that it makes things safer, but when you want to ask for the proof of the pudding is in the eating. Well, what was the change in accident rate, so forth? There are very few places that actually have produced data to answer that question, but the answer seems to be about 5 to 7%.
Accidents include pedestrian-related
Yeah.
accidents.
Yeah, although that's when you're talking about local residential streets, pedestrian accidents are extremely rare. I mean, pedestrian accidents tend to be in downtown areas and on arterial routes, so they're not typically the places where you find speed humps.
Is it all accidents at 5% or fatal accidents?
All accidents. The decline in accident rate was typically about 6 to 7%. There were so few fatal accidents. I mean, out of 1,200, there were only 2 fatal accidents. I'll tell you something else about pedestrians. We only had about 20 pedestrian accidents included in the sample of these speed hump locations. There, I found pedestrian accidents actually increased enormously. I don't know or believe it's statistically significant, but that's what we found. We found that the pedestrian accident had gone up tremendously where they had put in speed humps.
What was the margin of error in these studies? Because if it's about 5%, essentially, any advantages are gone.
That's correct. And in the study, all the estimates I have about fatalities, that kind of thing, it shows you what the standard deviation is. As far as the accident data on Albuquerque, that is, we're using such a huge sample size that that deviation would be pretty low. The other thing that encouraged me was the fact that the results I got were so similar to the other big study that was done in Portland.
Now, you also spoke about the highway speed limit. Now, I've heard it reported from an emergency room physician, and it's just purely anecdotal, that he's seen a lot more accidents since the national highway speed limit, was raised from 55 miles an hour. But is there any kind of consensus in the traffic community about that?
You're talking really highway stuff, which I haven't investigated that much. I'll say this, that in general, speed has more to do with severity of an accident than the chance of an accident happening altogether. One of the problems in government policy is that they are oblivious to decades of research that's been done as to how to not have an accident in the first place. All their focus is simply on this business of reducing speed. Reducing speed on freeways down to a reasonable level is a perfectly good idea, and keeping it at a reasonable level on other roads is too. reducing it on a road that already is pretty much a low-speed road where you're only going 25 or 30, and it doesn't seem, and you're not having any accidents, doesn't, is not going to really produce any benefit for the public.
Sorry,
Sure.
Martha.
I'm in Santa Barbara, and there's a great deal of traffic calming, not Humps, but all the
Yeah.
other stuff. And they're talking about reducing speeds to 15 miles an hour. Is there studies showing how, we've been told by our mobility coordinator, a social anthropologist, ecologist, that reducing speeds will get people out of their cars into alternative transport.
Yeah. Well, see, this is what they're pushing. They don't know anything. They've never studied accidents and what makes a road safe or not. All they have in their heads is the idea that if we just make everybody move slower, that must surely make things be safer, which is not necessarily true. I don't know of any empirical data that supports the view. I'll tell you that in Portland, Oregon, for instance, their downtown one-way street system, the signals are set to force you to go at 11 miles an hour. They feel that's the ideal speed. The trouble is that with the motorists they have don't correspond to that. That is, they're all driving these big hunking SUVs, and hardly any of them, other than me, try to actually do 11 miles an hour. So what you have is this jerky motion of rolling forward and coming to a stop, or rolling forward and coming to a stop. So the effect of their policy is to just generate a hell of a lot more air pollution, a hell of a lot more stop-and-go traffic. Other cities that do it are pegging it more reasonably, usually at 25 miles an hour. New York City, incidentally, which is the biggest pedestrian city in the country and one of the lowest pedestrian accident rates per capita, they typically peg their streets in Manhattan at a higher speed. They're typically going at 35 or 30. This idea that you're going to make things safer by going very slow just doesn't pan out. And the other thing about modal diversion is that, again, this is a claim that's often made, no factual basis for it. If you compare it to the other claims that are made that we have lots of factual basis for, you'll find that these claims are nearly always spurious. A community like Santa Barbara is simply inherently an auto-oriented community. You're not going to have any significant modal diversion to anything else.
Bill, is your question pretty quick? Go ahead.
I was just going to ask, is the report you did on Albuquerque available on the web?
Yeah, and she would know better than I do where it is, but it's there. I can send it to you electronically. It's actually available at several places on the web. There's even a British website that has it now.
No.
Okay.
Bromley Transport.
Yeah, the Borough of Bromley has it. Yeah.